Assalamu alaikum, you're watching Healthwise and I'm Dr. Tahira Shahid. Ever since COVID started, we have people complaining of not being able to breathe. They feel they're choking, they feel they're out of air, out of breath, and then this drowning sensation. Then we have this rush of all these people going for HRCTs, where ground glass appearance and pneumonia and everything to do with the lung. Today we thought we would invite into our studio a very, very distinguished, a very senior doctor, a pulmonologist who actually appeared in our program years ago. I would say years ago because it was 1.5 years ago when COVID had started. He almost started with the discussion right back in February, and he also published an article where he spoke about all these precautions that are now so commonly heard everywhere. Not only this particular pulmonologist, Dr. Mohammad Zaman Awan, who was the head of critical care as well, he, actually believes in a very different, approach towards corona, towards its precautions, towards how we should take it. And he actually believes in the conventional school of thought where the patient has to be heard. Every patient is different. You need to listen to the history. You need to treat the patient and not just the tests or the investigations. Thank you so much for joining us today, Dr. Mohammad Zaman. If I start praising you, we'll run short of time. And it was such a pleasure talking to you. First things first, when we talk about COVID and COVID affecting the lungs and this particular strain affecting the lungs directly, and how have the precautions changed? How do we need to go about it? Please go ahead.
Thank you very much for your beautiful words. Coronavirus, actually this may be in the world since many years, but the strain which caused this problem is different. It is H5N1. Okay. So it is highly virulent. At the same time, a smaller dose can cause the coronavirus disease. Prevention is more important because there is no specific treatment for history. In my school of thought, from where I trained, UK, we believe in history to the extent of 80%. So history gives a great clue to the doctor that where should he go.
Exactly.
Nowadays in Islamabad, coronavirus, and people have forgotten pollen allergy.
Right.
And
yes.
So there is confusion, and this confusion is not due to pollen allergy, but coronavirus disease. This confusion is prevailing all over the world. Nobody is certain about treatment, nobody is certain about follow-up, and the complications which are going to arise after treatment in the lungs, nobody is foreseeing for them.
And it's so important, not just do they suffer from coronavirus, but even after they recover, they have these symptoms where it continues in their lungs. And the problem is because of self-medication, because of medication that they are following from the net or from here or there, they're actually destroying themselves even more. You were mentioning how important it is to explain to the attendant as well, that what it is the mode of treatment and what are the different things along with the medication that the doctor prescribes. For example, breathing exercises and the use of steam, inhalation, the use of fluids. So could you please shed light on that?
Yeah, before that, preventive measures are more important. I mentioned, you very rightly said, I talked about these preventive measures, 4 points, 4 things, on 27th of February last year, 2020. And first most important thing is washing of hand with water and soap, simple thing. I discourage sanitizer. People are using sanitizer for fancy purposes.
Exactly.
No, I don't recommend. Yes, if you are going in motor car or traveling or somewhere else where there is no water or soap, you can't wash your hands. You can use but once. You can use sanitizer but once. If you are using sanitizer after usage, second usage, on second usage, so you are actually giving way to stay
so
the
you're
virus.
trapping the virus over there. So you don't use the sanitizer again.
So please, the important thing is
hand washing.
As per our Islamic teaching.
Yeah, you're right.
Washing of hands with water and soap. A Muslim, a good Muslim who is praying, is washing his hands and mouth, and special thing which I will narrate is he will clean the nostrils.
Yes.
And in Tibbi Nabwi, in Hadith of our Prophet Muhammad sallallahu alaihi wasallam, peace be upon him, that you should put water in the nostril with force and then remove it and throw it out again with force. So what is the aim behind? So many other aims which we don't know, but in our opinion, that nostril should be cleaned, rinsed, and
so cleaning the mouth, rinsing the mouth, rinsing the nostril, and also that act of wuzu where you're actually doing that. It's almost pre-surgical as well. So could you mention this hand washing, the right technique, because they just keep stressing on hand washing without telling us what is the right technique to wash the hands?
I will say 5 into 5. This is a simple, that washing of hands with soap and water, running water, like this 5 times, and then 5 times, and then 5 times, and then 5 times, like this, like this, and finally, and then washing with running water.
See, this is all there in for us for so long, and we just didn't know about it. And we were just listening to the sanitizer thing, causing dermatitis, causing all sorts of infections, just overusing it. Coming to the breathing techniques, sir, because you were demonstrating a very important breathing technique and telling me how important it is to breathe that way and how it's going to expand our chest, expand our lungs, and give it, increase its vital capacity.
I'll explain the breathing exercise practically, but coming to that, before coming to that, WHO has endorsed my way of washing of hands.
Definitely.
And precautions. We only mention one precaution, hand washing. No, there are other 2.
Right.
Hand shaking, hugging, and social distances. That is very important. So there is no mean of transmission of virus in this way. So coming to the your question of breathing exercise. Breathing exercise are as important as treatment.
Okay, you heard that. Breathing exercise is as important as treatment.
Because the treatment will be facilitated by
the breathing
exercises and will help in expectoration. We want to get rid of those secretion or infected secretion or virus or even superadded infection by expectoration. And how expectoration is ensued is by doing breathing exercise. You increase your horizontal diameter of lungs and then vertical. So the air entry will be more than normal in sitting position. How? That you raise your hands like this forcefully, because I am talking, so
and breathe in through your mouth.
And breathe in
to your full capacity.
Mouth, again forcefully, and then forcefully
bring them down.
Bring down your hands and breathe out
forcefully again. So you breathe in forcefully and then you breathe out forcefully.
Keep on doing for maybe 30 times. If one can do, a patient may not do more than 30 times, but keep on increasing slowly and gradually at any time of day, but preferably before meals.
Okay, so before meals, you need to breathe in through your mouth, raise your arms above your head forcefully, and then bring them down forcefully and breathe out from your mouth again. What is the importance of this pronation, of lying on your tummy and not on your back?
That's again very important. That is because anatomically, the lungs, most of the parts of the lungs have 3 lobes and zone on either side, so 6 lobes. So most of their part of lobes are occupying back of the chest, not the front. Front only frontal and a little part of middle lobe. So when we lie on our back, I mean supination position, the secretion will trickle down and accumulate in the most of the parts of lung. But we recommend to lie on their front, I mean prone position, So secretion will by
All
gravity.
right, so we'll take a short break over here and then we'll resume. Welcome back. Before going on the break, we were discussing how breathing exercises help us and how the prone position helps us. We will continue with Dr. Zaman and ask him what else are the precautions other than these, especially when, in terms of people using a lot of bronchodilators, nebulizing themselves and using all sorts of nebulizing formulas. So how does that do more harm than good?
Actually, if the bronchodilators are indicated in cases like bronchial asthma, or to some extent in emphysema, then there is no harm. But without being broncho restriction.
That means they shouldn't be self-diagnosing. Just like you said, they shouldn't be taking any sort of antibiotics if not needed. They should be going to a doctor and first be categorized as to what are the symptoms and what are they pointing to, right?
Yeah,
that is what.
Yeah, if there is no bronchospasm, there is no need of bronchodilators should be included in the treatment, because the bronchodilators will do its function as bronchodilation. So the secretions which are containing viruses in it will retain there and will not come out, will not detach from the intima of the lumen of the bronchial tree. So the secretions will remain there, stasis, and then there will be superadded infection.
So we should not encourage this kind of stasis. And what do you say about cough suppressants? People are very addicted to taking cough suppressants instead of expectorants. So how do you rate that?
Again, if there is no irritable cough, the secretion should be brought out. That is called expectoration. So the syrup which contains ingredient like guaifacine, which is mucolytic agent, and is thin down the secretions in the bronchial tree, and which are very tenacious, sticky.
So we should always look for this ingredient.
Yeah, so that should come, the secretion should come out, and this not only with this syrup, we believe actually in hot drinks like green tea, black tea, soups, and even hot milk tea.
And what is the role of steam inhalation? Because a lot of people stress on steam inhalation, and then we had a lot others who were speaking against it. No, so how important is steam?
In the same way as I mentioned about hot drinks, steam will do the same function directly. And thin down the secretion, and patient will be able to expectorate.
So they have to keep taking steam, they have to keep drinking a lot of fluids, keep themselves rehydrated, and avoid anything that contains a cough suppressant like dextromethorphan, rather choose something like guaifacine that actually causes expectoration. Also, along with this, what do you have to say? Because you've been seeing patients day, night, and like more than 7,000 patients worldwide. So what did you see? How do patients comply? And how is them? And if they do have, for example, lung is damaged and they have pneumonia, how do they improve on their health in the long run?
It depends totally on the treating physician. If he emphasizes on the treatment along with those supportive measures which help that treatment to act on. So my patients, when they listen to me, they send me their X-ray, HRCTs, and other relevant tests online, and I assess them, interpret them, and accordingly I request them to do this treatment, but along with the supportive measures. I am really satisfied. More than 95% patients, they comply with my instructions, and I get very good results. So prognosis in my treatment, in patients of my treatment, is more better, excellent, and I am satisfied.
But the doctor decides whether they have to be put on antibiotics or whether they have to be put on steroids, right?
Yeah.
They shouldn't be doing that at home themselves. So if
Yes, but in that we have to, as I mentioned about history, if patient is suffering from diabetes and maybe uncontrolled, along with that hypertension or cardiac problems or renal problems, when there is no excretion, proper excretion. So there the treatment is modified. Then we give steroids with great caution.
Right.
And we may give, because we want to take potential benefit of that steroid.
But only a doctor knows how to prescribe it and then wane it off. A myth was circulating that smokers are not going to get corona, whereas it's the exact opposite. Could you stress on that?
Exactly, it is opposite to that. That smokers, which I was mentioning about the mucociliary mechanism escalation, that is the natural phenomena of the cells which are lining the bronchioles at the end, ciliated columnar epithelium.
Right.
So they are propelling.
They are actually pushing it out, and when you're damaging it with the smoke.
But the same cilia can get damaged by 2-3 things, like mostly with the smoke, then industrial dust, and then mixture of fumes, things like chemicals, so they will damage.
So the mask not only protects us from COVID, but also protects us from all this dust and all this pollen, and we are getting so much of allergic rhinitis as well. So how do we differentiate between fever, flu, influenza, allergic rhinitis, pneumonia, tuberculosis, or this?
Very difficult, but taking history and performing a few tests, relevant tests, one can decide, one can differentiate the diseases, but there is mess, there is really mess, there is confusion, and people are taking multiple medicine. So antibiotics are not good things unless they are indicated, because they are against life, but they should be against the life of germs, bacteria.
Not your life. You're true about that. So it's you spoke about not misusing medicines and everything else. What about these SOPs? How rightly should we follow them? What is their importance? Like, we keep stressing on it all the time. You told us don't use sanitizer as much, rather wash your hands. What about the other things? We said that mask protects us from a lot of other things, and you said the normal social distance. And this normal social distance, and we should resort back to our adab, I think our conventional adab instead of a handshake. What other diseases or problems can it cause?
When we are talking about disease, we should not have a talk. If we are using the mask, because this is barrier.
Right.
So it is not. It will not allow to transmit bacteria or viruses. We are talking here about viruses. So viruses are in millions. In one cough, in one sneeze, millions of viruses they shred out. And to begin with, initially it is airborne.
Okay. Before we leave, sir, could you tell one little short thing about the use of aspirin that you suggested right back then? And now we know how D-dimers are rising, how people have clotting all over. And what is the use of aspirin or disprin in this, or Loprin as they call it?
In my regime, from the very beginning, in February last year, I started giving aspirin, soluble aspirin, with the name of Loprin or Desprin. But not to every patient.
Not to ones with bleeding tendency. Or ulcers, peptic ulcers.
Yeah, exactly. Or one can give with a calculated dose.
But it is very important to stop the clotting. So as a pulmonologist, as our senior, as our asset who has treated so many and who actually introduced us to corona and what the SOP should be, please give one message to our viewers before we leave.
Please strictly observe SOPs.
Right.
And don't use the name of SOPs using masks, don't handshake, don't do hugging, or even children, relatives, elders, please stop. And don't go to gatherings. Like I will say, I am Muslim. I try to be a good Muslim. So I am Muslim. I request them not to go to mass, which is very difficult. People may object on me. I am Muslim. I want to go to mass. But when it is allowed in Islam that if there is a problem, if there is transmission of disease, stay at home and don't infect others.
Thank you so much, sir. Thank you so much, Dr. Mohammed Zaman, for joining us. And today's pearls of wisdom from Dr. Zaman was truly invaluable for us. Thank you so much for watching. See you tomorrow, inshallah. Allah Hafiz.